So I just learned something very interesting that every healthcare worker need to know. So let's say you get a patient that you're worried they have a pulmonary embolism. You want to do CTAP protocol with contrast, or they have you suspect bowel ischemia. You want to do CTA with contrast. So anytime you want to do CT scan with contrast, you're worried about renal failure. If this patient is already having a renal failure, then what would you do? Do you do CT with contrast or you don't do it? So here's the solution for that. You go to MD Calc, you type in Mehran, Mehran, Mehran calculations. It's gonna walk you through a list, and then you put contrast media, you put 80 ml volume, and then you put the GFR of the patient. Let's say it's 50, 40 to 60. In this case, it shows you the risk for getting a dialysis with this contrast. It's causing renal failure requiring dialysis. In this situation, it's 0.04%. If the risk of causing renal failure requiring dialysis less than 5%, then go ahead and do the contrast if it's important. If it's more than 5%, then you think more about it. And usually there's a way to avoid contrast nephropathy, is that by hydrating 1 ml per kg 6 hours before the contrast and 6 hours after the contrast. And most of the time we hydrate more than that. So this is very important to keep in mind if you want to do CT with contrast in the setting of renal failure.